Hi, welcome to our Population and Community Health Assessment for Wake County. We are Crystal, Kelly, Crystal, and Courtney. Our population that we were assigned was Wake County, North Carolina. The population here is about 1,092,000, and the average income for household in Wake County in general is $73,000, and our poverty level is 8.9%. We are a very young in age county, about 30s or upper 30s is our average age. The majority of people in Wake County are white, and then the other quarter of people are Black at 21%, and then the rest of other different nationalities. We decided to focus in on a zip code of 27609 in Raleigh. The population in this zip code is about 32,000, more females than males, and again, about the same of population of culturally. Majority is white at 69%. Black population is a little bit less at 18%, and then the rest fall under other nationalities, including Hispanic. The main or average, income for a household in our specific zip code that we focused in on was $51,000, and unemployed, we've got a really high rate of unemployment at $29,000. So we decided to focus in for a lot of different reasons on adult individuals living at poverty level. The number that we could find was 8.9% of people living in poverty in Wake County. Our total unemployment rate of our zip code at 29% was fairly high. The unemployment rates were concerning enough for us, and then our diseases that we focused on were concerning enough for us to really want to grab this population to work at and to see if we could find some interventions for. So Wake County deaths and causes, 2017 and 2018 are the years we were able to grab the most recent numbers from. Wake County does an amazing job of finding resources, and a ton of resources as far as numbers and averages and percentages that we were able to get. So we had a lot of information that we were able to pull from and compare them with 2016's as well. These surveys are done every few years, so they're very up to date. Cancer was by far the leading cause of death in Wake County, followed very closely by heart disease. In 2016, there was not much difference. Again, cancer was the main cause of death as far as the population, and then heart disease again was a really close follow-up. Here on this one, it was a little bit more detailed with the breakdown of different cancers that were the cause of death. Mortality rates by race or ethnicity, culturally, and gender. African American men especially were at the top of the charts as far as leading causes or leading population at risk for death. Male more than female, and then Hispanic less than other races. Second leading cause of death, heart disease. Under heart disease follows a wide array of different diseases, CAD, heart attacks, heart arrhythmias like AFib, valve disease, CHF, or any other type of heart failure, and then congenital heart disease. Again, at the top of the list, just like cancer, African American males skyrocket these charts and are at a lot more of a risk than any other race or sex. In Wake County, the public health injury reports, deaths are at the top of this triangle. And then trickling down, you've got hospitalizations all the way down to injuries at work or home. So looking at our own zip code, transportational benefits are big. We've got a huge public transportation that's available, and the majority, I would say, of people do have personal vehicles. There's about 2 cars per household, but there's a wide population that still uses public transportation between the bus line mainly, and then Ubers and taxis as well. We decided to kind of zone in on this zip code of 27609, which is Raleigh, not North Hills. There are lots of different neighborhoods and apartments, stores, restaurants, hospital. Duke Raleigh is there. And then we've got some urgent cares, other medical offices, schools, lots of different things going on in Raleigh in this zip code. Some concerns were bus stops without shelter, although we do have clean, busy streets here. You might see an occasional homeless person, but not as much as more of the downtown Raleigh zip codes. Obesity is still a concern, and there are plenty of things to encourage this, such as fast food. Again, lots of different schools, bus stops, which just contributes to the wide and population of people using the bus lines. And then a big healthcare benefit is having all of the doctor's offices, special primary care, and specialties. There are 9 urgent cares around, and then Duke Raleigh has an emergency department as well. And then the health department and human service is available in this zip too. Here are some pictures. There's Target, Duke, our lovely fast food, some bus stops, DMV, and some apartments available as well. We were able to interview Laura, who is a clinical lead on the oncology floor at Duke Raleigh. She mainly works with inpatient oncology and then surgical patients as well. She agreed uneducated, English as a second language immigrants, and then poverty-stricken people are at higher risk within this population. And she mentioned all the many different screenings that are available and that we would be able to do. And then had some recommendations as well between health clinics, pamphlets, commercials, tele surveys, bulletin boards, different things. Anything really, she said, that we could be able to bring these people in the offices, screen them, and educate them on how important this is, especially in our population with cancer and heart disease, but her specialty has been cancer, so seeing how many deaths and how many patients' lives are being taken from cancer that might have been prevented. So an effort in Wake County in general does an amazing job at wakegov.com. They've got lots of different written materials, pamphlets on at every office, and then the health departments are locked and loaded with a ton of pamphlets and different availability for education. So I'll quickly hit on programs and trainings. There's been a lot, a big benefit of programs, trainings, conferences, and not as much so for our population as far as a poverty level. What I do love is that they're kind of going along with the times and are able to reach a lot of people with social media between Facebook, Twitter, or anything else, Instagram. And this has been so successful, even at a poverty level. This has hit hard because having a phone is very common even for unemployed or that population at poverty level. So I feel like that one seems to be the most practical as far as our population. So some benefits, again, we've got tons of screenings and transportation. We've got the availability of facilities and education opportunities. But then the problem is our weaknesses have been screenings received. We don't have people going to get screenings. They don't have the money. They don't have the information that tells them you've got to get screened, because if not, um, it's going to be, I don't have the money to go to the doctor's office until you have to go because you have terrible chest pain and you're having a heart attack and you're about to die, or the cancer is already at stage 4, and then death at that point um, it may be inevitable. A language barrier is another issue, especially for our Spanish-speaking population in this area. Our nursing diagnosis number 1 has been ineffective community therapeutic regimen management. Again, just because of our lower financial and education levels. And by the same reasons I've said, we've got lots of high mortality rates for cancer, nobody going to get screenings, and then the health protection and promotion is low. So we can do some interventions as far as education, healthy diet, avoiding smoking, just trying to get people in these offices to do physicals and screenings, and then eventually chemotherapy and treatment. Similar is deficient knowledge related to the cardiovascular disease. Again, people just don't always know that you need to go into the doctor's office to be checked, even when you don't think you've got a problem, or you can keep ignoring it until it's too late and you've had a heart attack. So again, education, diet, exercise, physicals, blood pressure checks, cholesterol checks, not smoking, and then tertiary treatments or interventions would be, again, at that point, treatment for their disease. So we've learned to be educated and to educate to promote a healthy lifestyle for our patients and our communities alike, and to be aware of our community, to be a change agent. So we've learned a lot through this project, and we hope you have too with listening to us. Thank you so much.